Welcome to the Recovery Lab. I'm your host, Joe Lemon, and today's special guest is Dr. Davis Koh. Dr. Koh runs a boutique physical therapy clinic out of Irvine, California, as well as teaches physical therapists through his educational platform, AQuire, where he and his wife, Alice, really focus in on trying to educate and arm a lot of our physical rehab specialists, from chiropractors to PTs, obviously, massage therapists, athletic trainers, and he gives them the skills that are going to be something that's really tangible and practical for them to take into the actual clinics. So sit back and enjoy this episode with my guy, Dr. Davis Koh. I've always really liked what you and Alice have built down there, like in Irvine, because for one, it looks great. You can kind of see like in the whole background. So once you kind of walk into your actual PT clinic, it's not like a typical, a hospital field clinic. You guys have a really warm presence. And I love the fact that you guys are in this educational lane because it's a market and it's a time when people are trying to skill up, especially with everything going on. They're looking for more ways to try to diversify their actual skill set. And I think what you guys are building out there with AQuire is going to be really, really impactful down the line for a lot of people, man. So I want to welcome on Dr. Davis Koh. Welcome on to the podcast.
Thank you. And thanks for that intro. AQuire came out of a need, actually, for me personally, where there were a lot of courses that were like niche courses, boutique-like courses where if for continuing education companies, especially ones that are nationwide, normally they would just try to hit the lowest common denominator, try to gather as much. So total hip replacement rehab or something very common, a common modality. And then when you got into something that's more niche, whether it be for our professional golfers, specific rehab or what things they're doing, or something for a new technique here or something, they just wouldn't know. It was hard to get to the CEUs. So for myself and other fellow clinicians, what they're always trying to do is get obviously their licenses. When they renew it, they need those CEUs and credits, and so they're always trying to at least kill two birds with something that they want to learn, but also something that would give them the CEU credit so they can just knock that out and not have to pay extra for a course that they have to take, and then they take the course that they want to take. And so AQuire was more of this boutique feel where we provided set up the nationwide CEU provider for those type of courses, where it can allow these people. So, for example, like a PGA Tour doc that's been on the PGA Tour for over 20 years, that he has specific types of protocols and exercises and techniques that he uses for his golfers, and why that just wouldn't hit the mass, but those people that really want it would go into it. So the frustration was trying to get a course going where he could share that information, share his knowledge, and also legitimize it, making sure that it passes through the different state boards and national boards committees for the different disciplines. So AQuire kind of is like that, kind of like a niche boutique con ed company, and we're not going to have the ultrasound or the AQuire course, but or just some of the basics of, but hitting those people that are looking for that.
Which is like, I mean, honestly though, which is like a real need, because I've gone to plenty of like trade shows, and you're at these trade shows, and I'm not in the actual courses, but I talk to people as they're leaving the course, and they're just like, yeah, I'm just here so I can get my CEUs. That's a common right? Conversation, right? I mean, people are like, yeah, I already know this stuff. I'm just here so I can get credit. And it's not really like a focus of, I'm here so I can pick up new skill sets and actually apply them. But I just want to get this done, put like a check in a box, and get back to what I was doing every day. So I think you guys really hit like something that's kind of like not really serviced that well, it seems like, in the PT market.
Yeah, and just going off of that, I mean, there's a lot of courses out there. So we do a strong vetting course. There's got to be like if I or some other instructors in our group have not taken the course, have not seen it, we won't just, but the people that we meet, the courses that are out there, they're experts in their field, or they're originators If it would be a course on, let's just say, a heavy ropes course, that battling ropes, you see them on Reebok commercials and Nike commercials. Well, the inventor of that, John Brookfield, he wants to do a course on more advanced ways of utilizing those ropes. Well, he invented it. I know him. I've taken the level 1 coaching, so I see how he teaches. So we also want to make sure that it's not just some hokey schmanoki, but is the instructor sound? Does he have the qualifications to talk about what they're talking about? Do they actually talk about, is their teaching methods actually productive, or is it just and is there so just the feel, the feedback, the lab time, what the materials are, and that all comes pre-vetted. And it's not just selling CUs to sell CUs. It's not like that at all. And just so these are just products that are have either sound evidence based, or sound cutting edge clinical studies that they have, or just clinical based stuff that is coming out that you just want to see. And so so I think that piece of it was also what I forgot to mention was that it was another thing about AQuire that allowed me, because I'd only go through people that I would trust. And even if I didn't get my CUs, I just want to learn that technique.
I got to hear your background story, because you used to teach, you used to be in the military, from what I understand, right? And you also teach like tactical training and everything else. Is that right?
Yeah.
I never asked you about this, but I've always been like super curious about it. So you got to kind of give me the whole
the whole spiel. Okay,
origin story here, man.
Yeah. So I was not in the military. So I want to get that clear.
Okay.
So yeah, I'm not up there with the military. For me, safety was just, because I did a lot of categories in my medical career as a physical therapist. So I was in acute hospital settings. I was in psych wards. I was in orthopedic. I was in sports. I was in home health, going to home health. I was in, and throughout these pediatrics and burn units, and I loved all things physical therapy, and that was part of it. But also what I saw in my experiences, starting as a new grad and in the last 22 years as a PT, the dangers. And there was one stat years ago that over 72% of medical practitioners will be assaulted at least once in their career. Wow. And that was kind of surprising.
72%? Is that right?
Yeah. And for me personally, I was, when I went to the psych ward at UCLA, people would attack you. They did not know what you were doing. They were they had maybe dementia. They may have some other issues, and they would attack you. And I was attacked multiple times, and you just have to find ways to not only protect yourself, but also protect the patient. You don't want to hurt them. You don't want to just go to blows with somebody that's, that might not be a good look as a healthcare professional. So that kind of got me going. I'm like, okay, this is a real thing, real friends, real situations. Statistics are there. I'm like, gosh, so I had some patients that were Navy SEALs and Navy SEAL instructors, and they had recommended their close quarters defense. And so I was fortunate enough to be allowed to go through training with that.
It makes a lot of sense that healthcare professionals should kind of have some sense of, I have 2 or 3 moves to make sure that I can get some separation, or at least kind of hold someone off, Talking about our whole industry right now, like especially where PT is going with everything going on, what's some of your thoughts about where this market is going for like physical therapists in particular? Do you see more of the home health care? Do you see more of the telemedicine? What are you kind of seeing as the future of the space?
Okay. It's a great question, actually. And actually, I was going to bounce back on when you talk about personal trainers.
Yeah, please.
It seems like things are going, that you do see, there's a lot of things that are overlapping, and that's one thing. So it's not no one's really siloed as much. The chiropractor, some of the best sports trainers that Olympic players, gold medalists are going to are some sports chiropractor that knows a lot about corrective exercise and training and whatever. and so on and so forth for PTs as well. One thing about personal trainer, like you said, the dangers is when they overstep their bounds, and just like so a tip I teach at some courses, they're not allowed to touch you. And so if they help you stretch, that's actually outside of their scope of practice for a personal trainer, and they're liable. If you do, even if they help you, like if you're bench pressing and they grab your elbow and help you lift it up, like a spotting, right? That's a liability. They're not allowed to touch you in their scope of practice. So if they're doing that, but now I'm seeing, some trainers, crack backs and do other things.
Yeah.
And so that's, but just to protect the personal trainer, just remember that, you're immediately liable. And just to be sure. Now, that being said, I know a lot of good trainers who are actually better at exercise science and corrective exercise than a lot of PTs with their doctorate degrees and so on. So I'm not saying anything really bad. It all comes down to the individual. But for the future, I do see where going to the homes, maybe that was a trend that was happening. It was getting much more popular to travel to patients' homes, to patients' workplaces, and those were those more independent contractors and some of these companies getting about 100, 500, 1,000 PTs nationwide or up along the coast to start seeing patients at their workplace or their home on an outpatient basis rather than them all going to a clinic. With the COVID situation and the new normal with telehealth, it was pushed fast, and you see some commercials where they talk about, oh, we saw virtually zero telehealth, visits. Now we see 5,000 a day, and that's true. So I think that's even though I think some insurances might stop that, and they keep saying before they say, oh, it's going to be, we won't do that. Well, won't pay for it anymore after June, and they say July, and so now say September because COVID just keeps changing, and they have to adapt to that. And so that really pushed telemedicine that was slowly creeping in to just be shoved up into the forefront. And so I think telehealth and just like online remote schools and stuff like that. My kid is already going to 7th grade, and they've already decided to do a hybrid 2 days in school and 2 days out of, or 3 days out of school.
For like
And
next
so,
year already. Is that
yeah.
Wow.
Yeah. They've already said, yeah, you choose your days you want to come in, and then the other days you want just to spread things. So it's becoming this new normal.
Crazy.
So I think, so medicine will be that way. And I think it'll be at least part of it, and then trying to adapt to that. And so we've been trying to adapt. I think we were, luckily my wife was able to make it to where we were one of the first telehealth medicine PT clinics in Orange County, just to get get that system going and be able to give efficient treatment and effective treatment online, and then still have the clinic open, being an essential services. We were still open for those situations where they just really needed, especially people who just had surgery, they needed actual manual hands-on care still, and so we were there for them for that. But I think that's the future. Remoteness is going to be the future as well. I don't know how. I think smaller boutique clinics will be the new norm. I don't think it'll be harder unless this COVID thing really gets calmed down, like they find that vaccine, they locked it down, it's not a big threat anymore. Kind of like what they did with AIDS, HIV. Now they've come so far along that they can have medicine that can make you almost zero. So
it has taken some
unless
time though. It's taken a while for that to actually run its course, right? We're talking 10, 15 years in the making, but yeah.
Yeah, that's true.
Yeah.
So that might be the new norm, where maybe those big gatherings or PTs having, a bunch of people in the gym or being part of a gym. There's a lot of clinics that are in a CrossFit gym, and that dynamic may change, and it might be just more boutique which still lends itself to, again, the safety issue. If you're the only female and you're the only one working there, because they're trying to lower the amount of patients coming in and out, and they don't want 6 or 8 PTs and all their patients coming in at the same time.
So I think you bring up some really good points. Telemedicine is like been all the craze recently. I was doing a podcast with the guys from Ortho Live, and it's like a telemedicine platform for surgeons, right? And
Mm-hmm.
and they're also working with other PTs too. And it's just like he said he couldn't have enough, like he didn't have enough slots to kind of get everyone on an actual call and on the meeting because they had so many docs reaching out to him looking for an actual like platform. And it makes sense if the insurance companies are paying for it, but when they stop paying for it, I think that that's going to bring some other challenges. But this idea of boutique places, to me, I don't know how that will go anywhere besides up with the amount of, volume, like high volume places that just can't function like that anymore. It's almost impossible with the whole like COVID like guidelines, right? And I have several clients who have very busy practices and clinics, and it's exactly what you're saying. They have a patient for 5 to 15 minutes, and it's a middle, and they're running through people, and it's busy, and that's how that was their model that was working for them. But now they've had to totally pivot on their ear basically, and now they have to slow things down and space everything out. So I like this idea of where boutique is going. Do you think it's gonna be more cash pay, or do you think it's gonna be more insurance pay still with the boutique model?
Oh yeah, so with the boutique, yeah, and that, you brought up a good point with the timing. So now, before they could just kind of keep people milling around in a giant gym
Mm-hmm.
and see one person for 10 minutes, another person for 10 minutes, and just keep that mass and that quantity per hour, and
Mm-hmm.
that's changed. So that now, so what I think people are looking for, and even for this generation of everything needs to be now. They're not here to joke around,
Yeah.
not screw around. I mean, they're really here to make it happen. I think the techniques, that whether it be a hands-on technique, whether it be a modality, they got to bring so much more to the table. You can't spend just 15 minutes on an ELvation machine lying on the bed and then waiting for that to happen, and then do another 12 minutes of ultrasound. And these are all 70, 60, 70-year-old technology, the things that have been around. You can't do that anymore. They need to see it fast. They need to get it moving, a bang for the buck, and especially in a generation where everything's Insta, the page loads up takes more than 3 seconds to load up. They're out of there, right?
I'm upset.
So,
Yeah, I'm like,
yeah, people are pissed.
yeah.
So I think they expect efficiency too. So now that 10, 15 minutes needs to be very, very efficient, especially if they're going to be going down to more one-on-one because of, let's say, even in this COVID environment for the next year. They have to make that very, very, if it ends up being a 20-minute or whatever, that has to be very, very efficient and the most bang for your buck. And so that's why certain techniques are more efficient than the old school massage it out. Certain techniques, certain modalities, like a class 4 laser, or even like the focus shock wave, that the bang for the buck is very, very important in the return, and getting good at that, knowing what's really going to help out, what's really going to bring a lasting change in a relatively short amount of time, or at least within that same amount of time, you're getting 3 times the benefit than you would have with old school stuff in that same amount of treatment. And so I feel like those that really want to just have quality care, see the doc they want to see the PT they want to see the whoever they want to see for those techniques or those things, they can't, and HMO is not going to pay for it. Their primary insurance, PPO, is again a $5,000 deductible, so that's never going to happen. So then they'll just start paying cash immediately. And I think that will be the my prediction, that would be that's the trend that's probably going to happen. That cash, and that those that have or will start spending in their own way. And
Yeah, I mean, honestly, that's some really good insight, because it's been one of those conversations I've been hearing happening online. Like, there's a couple of Facebook groups and LinkedIn groups where like cash-based PTs, and I see those groups growing too. Like, I remember whenever I think Jared think his last name is Carter, I believe, but he also teaches courses and teach people how to kind of launch their own cash-based PT clinic. And I remember once it was like less than 1,000, and then it's at 3,000. Then you see it in the 5 and growing. And I'm like, all right. So the word's getting around, and people are kind of taking it serious, which is nice. I think it's
Mm-hmm.
great.
Mm-hmm.
And it makes me think about the future opportunities for a lot of these younger PTs coming out the gate. Like, where do you put your time and effort and like energy? Obviously you have to have certain skills, but those skills need to also be relevant skills, not just I got the check in the box skill, right? It needs to be something that if you have somebody that's paying out of pocket, they want to get a result. You normally, right? Especially if they're in pain. So, are there any major courses that you guys are rolling out with right now that you're really kind of pumped about as far as helping people kind of get some different type of outcomes at the clinic?
Yeah, so well, that's great they brought up new grads, and that is a challenge because back in the day when when there were traditional small clinics, or a small clinic could have 12 PTs, we have a good mentorship. You had if you're working for a hospital or something, they had good mentorship. So you had people, seniors, all the way up to having 20 years experience, 10 years experience, 5 years experience. But now a lot of them are going out on their own, and sometimes because it's boutique or whatever, that they don't have a mentor.
Mm.
And at least with PT, that's probably one of the concerns that I have when you go to a younger person, because it was very hard to. So one of my the top student at USC PT school, which was at that time, well, it's been ranked number 1 or number 2 in the last 18 years, but their top number 1 student went to a clinic that she was the only PT.
Hmm.
There was no mentor. She was running the show.
As a
And
brand
that,
new grad?
yeah, brand new grad. So even though she was a bright individual, I mean, the medical model, and I encourage people, PTs, when there was a California Physical Therapy Association special interest group had invited me to talk to students from different schools about my view about taking a residency, or what does a new grad need to do. And one of them is just to find a place that you can get mentored, even if it's a very small place, somebody where they can watch over you, because the medical model is, even if you graduated from Harvard medical school, Stanford, or whatever it is, once you graduate, you become a lowly intern, right? You don't become some hot shot doc. You got your MD from Harvard Medical School, Johns Hopkins. They don't care. You're a lowly guy working 80, 90, 100 hours a week, and you're under your chief resident, the attending physician, and all these people that are above you, and you're in there for years. A surgeon's in there for at least 6 years, plus a 7th year if they want to do a specialty or a fellowship. Of being, working through all those situations under the supervision of an attending and doing pieces of it, and not being, you don't want to go to someone who just graduated med school and have them do surgery on your mother or something like that. And
I'll pass.
so, so with physical therapy, there is a year-long option, but then the new grads, it's an option. It's like a fellowship. You don't have to do it. It's nice to, but if you don't want to, you can still get your license. So for those people, I would say take courses, at least get some courses down where you're taking these continuing education courses, get certified. So you're not just watching it on YouTube University or just kind of figuring out from hearing it from here and there, but you're actually getting a foundation. And then from that foundation, practice through that foundation rather than a bad foundation of just a lack of education, And so, and having someone at that course guide you through it. Those details make all the difference, and that's what you pay when you're paying cash. You're paying for those details. It's not enough to on YouTube you can kind of see what that technique was or that exercise, but that's like it's so that's not what you get paid for. It's that what makes a good person great is that last 5-10%, that last 5% actually. And if you don't get that little nuance, then that makes all the difference. And it could make you a super. Even Kobe with his, you remember those details? Have you seen that on? Randy? He was just talking to. I think he did Jason Tatum goes, "Oh, if you had just, instead of curling around and grabbing the ball here, if you'd have just stayed behind your man who set up the screen, then that guy who was defending you could not reach you in time when you were taking that 3-point shot. So just take one step to the right and you're good." And so it was just that one step. And I see that in whether it be cooking or machining or a $3,000 suit versus a $200 suit. You can see the details, the stitching, the quality. And so I think that would be the courses that I would recommend are ones that kind of hit a lot of different body parts for a new grad, a lot of different body parts that could be applicable to, so like IASTM is these instruments, these surgical looking instruments that help break up, it's for soft tissue work, but it can be used for hand patients, your knee, your neck, your shoulders, and it's very quick. So I would recommend courses that give you something that's can hit all parts of the body, and other ones that can also is fast. So neuromuscular taping, kinesiology taping, it works on a lot. You see those bright color tape on all those Olympians. Yeah. It's fast and you can hit all different body parts. So that would be one where I'd want you to learn, because now you can help whatever patient that comes in your way, and give them something that's fast, efficient, learning a certain modality, learning a certain, just the applications of protocols, because that will help you just kind of get there faster and not fumble around with even just like a shockwave or focus shockwave or or classical laser. What is the latest research? What's the best application using that for this type of situation? If they can get there faster and get those protocols locked in better, especially as a new grad, and learn that the right way, then they can. That's another way to have their own quote unquote residency on their own, instead of an official residency, if they're not going to do an official residency, and build on their skills. But that building of the skills need to be through the classes if they're not getting it through an official residency or fellowship program, like I said, like medical students would have done, and have that mentorship in that way, and take those courses multiple times. Because all those, even every course that I taught, like that, the one I talked to you about, the instrument assist soft tissue mobilization, that is, every time I've taught it, and I'm averaging about 30 to 40 seminars a year. It's always been different. My presentation power has always changed, a different type of research, a different way to do it, just to add it on. And so things are always evolving. So even if you do take it multiple times, again, to reinforce what you learn and just hone in any mistakes and have somebody actually watch over you. Again, if you don't have a mentor that you're working at, or that you're not in an official type of residency program, these continuing education courses, and being in the know and knowing that, not just relying on someone that has 4 million
views or
followers. You're actually knowing, because they can actually say, they have some authority behind it.
I would really say, that's a phenomenal point, honestly, especially because, one of the things that I know is taking off like crazy. You guys are definitely seeing it too, because I was talking to Alice about it for a second, is that people are online consuming content like crazy, and it's great. It is great that we all have access to free flowing information.
Right.
Is it vetted? Your channel, yes, but others who are just putting out content, because anybody can fire up a camera and just upload it, right? And so, is it vetted? And two, those nuances really, really matter. I know every time I'm training someone with the actual piezo wave, if I don't spend time with them to help them slow down and really change the angles and pivot the therapy source and really try to find the right depth of penetration, like those little things. It's not complicated to use. Very simple device. There's only 6 buttons, really easy. But how you use it and understanding when to apply what, man, that right there can be night and day, all about your outcomes, because patients can get extremely great results with one person, have the exact same tool with somebody else, and they're like, I didn't feel anything, I didn't get anything out of it, So
Yeah.
it's so much dependent on those nuanced details.
Yeah, already they feel worse, and then you
Yes.
just, yeah, and just like you said, like PA's away. If you're going too fast,
Yeah.
you're gonna miss it too.
Yeah.
And some of them treat it like another machine. Oh, it's an ultrasound. I know how to do that. No, you don't. You really don't, big
Right.
guy. And some of those things can hurt you. You can burn somebody. You can,
True.
and yeah, and then even those knowledge details of even just the contraindications. They don't even think of that. Some of the things, and so. Um, and it's, yeah, those details can really help somebody look really good, make uh, and also again look good by actually really helping them, because you really got the detail in that technique or in that modality to bring
Right.
the most out of it and show what it can really do. And that's the big win. They go, oh my, especially when you're dealing with a patient that's already come in with some type of injury, and you're being either you're going to be inefficient, it's not going to work, and they felt like they wasted their money. And what is this, And but if you can really hone it down, and even the size of the heads, right? Just even the PAs, where they're just different size. If you're missing the size from the get-go to get that first buy-in, you might have lost somebody that really could have benefited from a laser or a shockwave or a tape or a ART technique or a fascial technique or stretch or something like that.
You have to tell us what's kind of next for your clinic, as well as what's next for your educational platform, AQuire.
Okay, so for AQuire, I think one of the pivots will be to a lot of the courses that were once exclusively all live will have some version of both, where there might be a hybrid, um, because of that fact. Because things are going into more and more telehealth. I know a lot of people are getting Zoom fatigue and stuff like that, but
Yeah.
the courses might be more, just because even educational, like I said, my kids' middle school, that might be the new norm. So we're trying to have the materials ready in that way. But at the same time, the live, interactive, see it, experience it is actually very, very important. So we still want to keep that component available, and just again make it more efficient, where maybe the written exam or some of the lecture part is not part of the whole live package, and more just the pure experience part, or depending on the course. So some of them will be able to just do both in one shot. For the clinic, again, we minimize as much or be as efficient as possible with the technique. So like the IASTM has that more of a separation, which people like, where you're not holding them,
Hmm.
contacting them as much. So modalities that are actually working efficiently, like a shock wave or a laser, where you can stay away from them. So there's
Hmm.
a mind, so they're getting some type of treatment without having to put a lot of the same electrodes or something like that. And
It's a good point. I
they're
didn't think
getting,
about that. Yeah,
yeah,
that's a great point.
yeah.
Yeah.
So if they can kind of stay away and then not have 45 minutes with that same person as much as possible, and just kind of there might be so we're just trying to see how that will be. But I think, again, just trying to keep that separation as much as possible, be as efficient as possible. The one-on-one treatments, we've always done one-on-one anyway, so that wasn't a new thing. We've done that, so it wasn't as big of a stretch. But even with us, we're still with our private rooms, and it's not in an open, that we're still making sure that they get their private time, and then they're not exposed to other clinicians if they don't need to be. They're not exposed to other patients if they don't need to be, and that might be the new norm. And so that would also impact, how many we can actually see a day. And so that would be, and so we're just trying to be mindful, and hopefully either be more efficient so you can see more, but not have overlap or crowding, but also and still deliver a good product.
Dr. Koh, I mean, honestly, this has been great having you on, man. And please tell everybody how to find you, how to learn more about your actual platform as far as the educational piece and your clinic.
Okay, well, the educational piece is www.askacquire. That's AQUIRE, askacquire.com. That's all in one word. Askacquire.com. KOHPT.com is our website. And just dealing with, and so um, that's still up and running. And Yeah, I think that'd probably be the two big ones.
That's perfect, man. That's perfect. Well, you know what, man? I always enjoy talking to you. I'll definitely have those links in the actual show notes. And
Okay.
boom, it's a wrap.